Welcome back to the Morning Blend. Fix cataracts and bring your sight into focus. NVISION Laser Eye Centers have some of the most advanced technology to partner with skilled surgeons to treat the problem. Today we are joined by ophthalmologist Dr. Paul Casey and Executive Director Brian Jones of the group to discuss a new way to do cataract surgery called Relax. Good morning to both of you and welcome.
Good morning, Dan.
Brian, let's start with you. Tell us about NVISION and your commitment to delivering the very best eye care.
Well, NVISION is committed to delivering the very best eye care. We identify skilled, experienced surgeons in every given region, partner with those surgeons, and ensure that they have access to the most advanced surgical technologies. For example, in California, we were the first to use the LensX laser. And our surgeons have performed thousands of laser-assisted cataract surgeries to date.
And doctor, what is a cataract?
Well, cataract is when the lens inside the eye becomes cloudy, and it's a natural part of the aging process. We treat cataracts by surgically removing them and implanting a crystal clear artificial lens.
So that's the technique to remove that.
Right. So the surgical removal, and I can summarize those steps briefly, starts with an incision through the cornea to gain access to the eye. We then create a hole, it's called a capsulorhexis, in the front part of the lens. We then have to break the cataract up into little pieces and remove them with what's called a phacoemulsification machine. A clear lens is then implanted in the eye, and the wound is closed.
And what exactly is Relax?
Well, Relax is a major advance in cataract surgery. It stands for refractive laser-assisted cataract surgery.
And we're showing the video now.
Right. This is the LensX laser, and the LensX laser brings a new level of accuracy and reproducibility to refractive cataract surgery.
And can you kind of describe to us a little more in depth about the laser and how it works?
Right. Well, the LensX laser makes the incisions precisely and accurately and reproducibly without any surgeon involvement. We don't have to do the incisions by hand anymore. So when we do the corneal incisions, we can program them to go exactly where and how we want them. So there's differences between standard cataract surgery and LensX surgery.
And that is how that is different than the standard way to operate on a cataract.
Exactly. When we do the standard surgery, I have to, for instance, make the corneal incision by hand using a instrument. But when we do the surgery with the LensX laser, we can go ahead and program that incision so that it's automatically and precisely where we want it to be.
And what are the other steps that are different with Relax?
Well, after the incision is made, we would then go on to make what's called the capsulorhexis. Now that's a critically important step in the outcome of patients at cataract surgery. And by hand, when we make the cataract incision, the capsulorhexis by hand, we're using a handheld instrument, and I try to make it as round as I can, but I can't do what the laser can do in terms of the centration and the size being the same all the time.
And the precision of it, yeah.
Right. So when the capsulorhexis is more precise, the lens, when it's implanted, tends to center and provide the best visual outcome.
And what about the actual cataract removal itself?
Well, that's the best part about refractive laser-assisted cataract surgery. When you do standard cataract surgery, as shown on the right here, you would have to break up the cataract using the machine. The LensX laser, though, will fragment the cataract into a lot of little pieces, and then they come out more efficiently, and they allow me to use less phaco energy than you would need to do otherwise.
And how long is a typical surgery?
Oh, it takes about 5 minutes to 7 minutes.
It's very fast.
Yeah. In clinical studies, there was decreased power used and decreased time used with the LensX laser when compared to standard cataract surgery.
Now, Brian, is this covered by health insurance?
Most insurance plans will cover most of the costs associated with a relax surgery. For example, they cover the cost of the surgeon, the cost of the anesthesiologist, the cost of the center. With relax, however, there is an additional cost to perform the surgery, so that would result in an out-of-pocket cost to the patient.
And how can patients get more information?
Very easily. They can call our center at 702-633-2020, schedule an appointment. We're offering a no obligation, no fee consultation, and we'll determine whether or not you're a good candidate and discuss all the options from there.
And doctor, is this something that a lot of people go through as they age? Cataracts?
Right, it's a natural part of aging, so there's really no way to avoid it. So sooner or later, you and I and Brian will all be here. Who knows what they'll be doing then? Yeah.
But this is the most advanced way to remove them, and very precise as well.
It really is. The technological advances in our field are really terrific, and it's a pleasure to help patients see better this way.
They don't have to suffer. They can get help. There is treatment out there.
Yeah, that's why we call it relax. You know, it's nerve-wracking to have eye surgery. So, you know, in coming up with an acronym for the procedure, we chose relax because patients can relax and have a good outcome.
Well, thank you so much. Appreciate it.
Thank you.
Appreciate it.
If you would like to learn more about Relax, the exciting new treatment for cataracts, just head to the website or call the number on your screen.